Good day, everyone. Hi, I'm Michelle Ibolis, your caregiver student from Sasin, Quezon City. So today, I'm going to perform a care for nasal gastric tube or inserting a nasal gastric tube. So the definition of this is the method of introducing a tube from the nose into the stomach. So the purposes and aims of this is to feed the client when oral intake is not possible, to dilute and remove consumed poison, to instill ice cold to control gastric bleeding, to prevent stress on operated site by decompressing stomach of secretion and gas, to relieve vomiting and distension. And then the equipment required is the nasogastric tube in appropriate size. So pretend we have a nasogastric tube. So pretend the syringe is this one, the lubricant, the cotton balls, kidney tray, stethoscope, a clamp, a marker or pen, steel tray, pretend the steel tray, a disposable clean gloves. So here are the pictures. Pretend that we have this one. So we have the clean gloves, the nasogastric tube. So this is the water-based lubricant, and the stethoscope, and the clamp is like this. So this is like the sample of nasogastric tubing. So for the care action or procedure, we need to check the doctor's order for inserting of nasal gastric tube. We will need to check. This clarifies procedure, the types of equipment required. The next is explain the procedure to the client. So explanation facilitates client cooperation. Next is gather all the equipment required. So we already gather the equipment. Organization provides accurate skill performance. And then next is we need to assess the client's abdomen. Assessment determine of bowel sounds and amount of abdominal distension. And then we need to perform a hand hygiene and wear the gloves before we start the procedure. The spread of microorganisms, but sterile technique is not needed because of the digestive tract is not sterile. Gloves protect from exposure to blood or body fluids. And to high Fowler's position or 45 degree if unable to maintain upright position. Upright position is more natural for swallowing and protects against aspiration if the client should vomit. Then check the nostril. Check the name for patency by asking the client to occlude one nostril and breathe normally through the order. Tube passes more easily through the nostril with a large opening. Clean the nares by using cotton balls. Select the nostril through which air passes more easily. Measure the distance to insert the tube by place the tip of tube at the client's nostril extending to the tip of earlobe. Extend it into the tip of xiphoid process. Mark tube with marker, pen, or piece of tape. Measurement ensures that the tube will be long enough to enter the client's stomach. tip of the tube at least 1 to 2 inches with water-soluble lubricant. So lubricant reduces friction and facilitates passage of the tube into the stomach. Water-soluble lubricant will not cause pneumonia if tube accidentally enters the lungs. So pretend that we have a water-based lubricant jelly. And then we will put at least 1 to 2 inches. And that I'm going to insert the tube on the nares of the client. So insert the tube into the nostril while directing the tube downward and backward. So following the normal contour of a nasal passage while inserting the tube reduces irritation and likelihood of mucosal injury. The gag reflex is stimulated by the tube. The client may gag when the tube reaches the pharynx. Instruct the client to touch his chin to his chest. Encourage him or her to swallow. Swallowing helps advance the tube, causes the epiglottitis to cover the opening of the trachea, and helps to eliminate gagging and coughing. So advance the tube in downward and backward direction when the client swallow. Stop when the client breathe. If gagging and coughing persist, check the placement of the tube with the tongue depressor and flashlight if necessary. So pretend that we will checking it, that it goes there in the right direction. Excessive coughing and gagging may occur if the tube has curled in the back of a throat. So keep advancing the tube until marking the tape is reached. So forcing the tube by injure mucosa membrane may injure the mucosa membrane. For nursing alert, do not force. Rotate the tube if it meets resistance. Forcing the tube may injure mucosa membrane. Next is discontinue the procedure and remove the tube if the tube are signs distress such as gasping, coughing, and the inability to speak or hum. The tube is not in the esophagus if the client shows signs of distress, it is unable to speak or hum. While keeping one hand on the tube, verify the tube placement in the stomach. Aspiration of a small amount of stomach contents. Attach the syringe to the end of the tube and aspirate small amount of stomach contents. Visualize aspirated contents, checking for the color and consistency. The tube is in the stomach if its contents can be aspirated. Auscultation. Inject a small amount of air, 10 to 15 ml, into the nasogastric tube while you listen with the stethoscope approximately 3 inches, about 8 cm below the sternum. Obtain radiograph or place a tube as ordered by doctor. If the tube is in the stomach, you will be able to hear the enter or whooshing sound. If the tube is in the esophagus, inject the air will be difficult or impossible. In addition, injection of air causes the client to belch immediately. If the tube is in larynx, the client usually unable to speak. Secure the tube with tape to the client's nose. Nursing alert, be careful not to pull the tube too tightly against the nose. Constant pressure of the tube against the skin and mucous membrane causes tissue injury. Okay. Clamp the end of nasogastric tube while you bend the tube by fingers not to open. Bending the tube prevents. Put off and dispose the glove. Perform hand hygiene to prevent of spread of infection. Then, replace the proper dispose of equipment to prepare for the next procedure. Record the date and time, the size of nasogastric tube, the amount and the color of the drainage aspirated, and relevant client reactions. Documentation provide coordination of care. Sign the chart. Report to the senior staff to provide the continuity of care. So, inserting the nasogastric tube is done. Thank you for watching. Now, I'm going to perform the removal of nasogastric tube. So, for the procedure or care action, we need to assemble the appropriate equipment such as kidney tray, tissue, a gauze, and disposable gloves at the client's beside table. So, organization facilitates accurate skill performance. Explain the procedure to the client or what you're going to do. Providing explanation fosters cooperation. So next is put on the gloves to prevent the spread of infection. So now I'm already put the gloves on. So now, hi ma'am. So today I'm Michelle, your caregiver. So I'm gonna help you to take off the tube. Is that okay? Okay. So now we'll remove the tube. Take out the adhesive tape which holding the nasogastric tube to the client's nose. So remove the tube by deflating any balloons. Do not remove the tube if you encounter any resistance not to harm any membranes or organs. Do not do another attempts in an hour. Simply pulling it out slowly at the first and then rapidly when the client begins to cough. Continuous slow pulling it out can lead coughing or discomfort. Conceal the tube. Be sure to remove any tapes from the client's face. Acetone may be necessary. So acetone helps the adhesive substance from the face. You should also wipe acetone out after remove the tapes because acetone remain to the skin may irritate. Removing the nasogastric tube. So next is we need to provide a mouth care if needed. So to provide comfort, and then we need to put after that one we need to put off the gloves and perform hand hygiene to prevent the spread of infection. And then record the date, time, and the client's conditions on the chart and be alert of for complaints of discomfort, distension, of nauseous after removal. Sign the chart. So, documentation provide coordinations of care. Giving signature maintains professional accountability. Dispose the equipments and replace them to prepare for the next procedure. And then report to the senior staff to provide continuity of the care. So, removal of nasogastric tube is done. So, thank you for watching and God bless.